It's one of those things. It's very easy to say about moving doses and getting the resources to the frontline folks that are vaccinating the community. It's another thing to be on the ground and actually doing the vaccinations and seeing some of the logjam that do occur with the supply chain.
Dave Schmidt is the chief nursing supervisor at Suburban Community Hospital. He's working every day to get shots in arms.
We are seeing staff going out sick with COVID, which is creating then, staffing shortages in the hospital, which then is very difficult to care for the patients that are approaching our hospital for care.
And Dave was one of those staffers. Recovered from COVID-19, he knows it's more than a job to facilitate vaccinations, but says the new CDC guidance may create some problems.
We do want to get this vaccine to the community and to those vulnerable, but we have to make sure that we have enough for the frontline workers and the hospital-affiliated staff before we do that.
As the CDC rolled out publicly its new plans for COVID vaccinations, instructing states to begin giving doses to people 65 and older, some in the health fields raised red flags, saying the mandate doesn't meet the supply.
The vaccine that we quote-unquote we have received this week, we haven't all received and isn't ready to be even given. So you have to take that in consideration.
Dr. Rachel Levine, Pennsylvania's health secretary, says when she gets written notice from the CDC, she'll work with those new guidelines, but says that she's already instructed hospitals with vaccine to move ahead to other groups in line rather than waste the vaccine waiting for people in that 1A category to show up.
And essentially becomes first come, first serve for people over 65, of which there are very many. And if you do that, then the people who tend to get vaccinated are the people who have the most resources. The people who can really work the system or have lots of time on their hands. That's not the way that you save the most lives.
Health experts in the region say supplies are still limited, and the states need a clearer picture of how much and when the vaccine shipments will come their way before it can commit to vaccinating more people in less time. Deanna Durante, NBC10 News.